Hi, welcome to episode 12 of Oscas with Mudau ES. Today we will be doing Puerperium or postpartum assessment. This is an assessment done to identify any early signs of complications in the woman who has just given birth or postpartum. As in all procedures, wash your hands to prevent cross-infection. First and foremost, greet your patient and therefore introduce yourself so that you can create respect and to gain trust. Do not forget to also introduce your assessors to the patient so that the patient can familiarize herself with the staff around her. To gain consent, explain the whole procedure to the patient. This includes what you are going to do and why are you doing that. This will also include that you will be touching the patient's breast, you will be palpating the patient's abdomen and also the legs. This is to make sure that the patient is aware of what you are going to do. Once consent is gained, ask the patient if they may need to go to the loo to empty the bladder or to pass some stools before you begin with the procedure. Immediately assess the patient's environment for safety consent as in accordance with the safety policy, and also check the patient's history for what has happened when the patient was giving birth, what type of birth did the patient do, and so on. You will need the following things so that you can be able to comply with the procedure. Patient's record, where you will be able to compare the history of the previous time the patient was here, and where you will be also be able to record any findings. Hibitane in water, sterile swabbing pack, sterile glove to prevent cross-infection, antiseptic hand spray to also control or prevent cross-infection, linen saver to prevent making dirty of the linen of the patient, red plastic which you're gonna use to discard anything which is coming from the patient, a ruler which is centimeters so that you can be able to measure the fendal height. Identify your patient using the correct procedure, which includes using the patients verbalizing their names and comparing them with the IdentabELD and the computerized form. This is very important. Close the curtains around the patient to create privacy so that the patient can be comfortable throughout the procedure and to create respect for the patient by other patients. Once privacy is maintained, ask again the patient if they are still comfortable before you begin. Therefore, decontaminate your hands before you can begin. For us to do the assessment properly, we will be using the bubbly memoic, which is assessing the breast, ureter, bladder, bowel, lochia, legs of the patient, emotional state, and also the epistomy, which can be the lacerations of the patient. Kindly ask your patient to remove the top part of the gown so that you can be able to palpate the breast very well. On assessment, check the color of the skin if there's no redness showing. Make sure that you check if the breast is not swollen. Palpate the breast using a circumambulation to check if the breast is not tender and there are no lumps present. Once done, also check the nipples if they are not cracked, if the nipples are actually inverted, protruding, or flat. If they are flat, this might be a problem when the baby is supposed to be breastfeeding. Check around the nipples again to check if there are any crackings available. While stabilizing the uterus at the symphysis with one hand, put the other hand over the fundus and press firmly, going down slowly up until you feel the fundus. Once you feel it, Measure from where you felt the fundus using the ruler with centimeters to get the measurements. Once you've determined where the fundus is firm, midline, and also if it's below the umbilicus, if the fundus is firm, do not massage, it is not necessary. But if the fundus is not firm, massage up until it becomes firm. Support the lower uterine segment during fundal massage to help to prevent the uterine inversion. This is also the reason why the patient should actually empty the bladder before you do the procedure. Before you do the bowel assessment, make sure that the patient's bed is flat. Kindly ask the patient that when did they last pass stools? This is to determine if they have normal bowel movement or even have been passing gas in the past few days. Use your stethoscope's diaphragm to listen to bowel sound, following all the 4 quadrants of the abdomen, moving it clockwise. Ask if there is any sign of pain on touching or on palpation, and ask if there is any pain in the perineal area. If the patient has had a cesarean delivery, assess the surgical incision for drainage, edema, ecchymosis, redness, heat, dryness, and intact suture line. During bladder assessment, ask the patient if they've urinated since delivery. Check if the bladder is distended or not. Check and ask the patient if they are feeling pain when they urinate, if they are having a burning sensation during urination. Assess the urine color, the foul smell. This is done to exclude UTI. Lochia is the vaginal discharge a patient has after giving birth. We have to assess the smell, and for us to assess the smell, we have to ask the patient if they have smelled any foul smell. This is to exclude infection. We have to also check the consistency and amount, which can only be determined through asking the patient that how often have they changed their pad on daily basis. We do not also have to forget to check for the lochia color. It is said that the brighter the color, the better. There is a dark red, also known as lubra, which is a normal color which is found between 1 and 2 days after giving birth. We also have the brownish, red or pink color, also known as the serosa, which is normal between 4 to 10 days postpartum or after giving birth. And lastly, we have the yellowish color, also known as the alba, which is the color that comes after 10 days postpartum. Remember, the brighter the color, the better the patient. To assess the patient's legs, we will assess for swelling if the legs are swollen or not, to check for the pitting edema, to assess the temperature of the skin, and also to check if the color of the skin is red or not. To assess episiotomy of the patient, turn the patient to the side. Check if the lacerations are healing very well. Check if there is swelling. Check if the patient has no pain and is comfortable. Check for redness, the type of discharge. Also assess the sutures if they are still intact. To exclude postpartum stress, assess if the patient does not have fatigue, they do not feel sad, if they are crying and unable to care for themselves and the baby. This assessment will be able to determine if the patient is stressed or emotionally drained. To maintain safety of the patient and cleanliness of the environment around the patient, and also to prevent cross-infection, discard everything that you have been using on the patient. These include the linen saver, the swabs, the gloves, and any other material that has got into contact with the patient. Decontaminate your hands once more after discarding the gloves that you are wearing and the other materials that you have been using to the patient. This is to prevent cross-infection. Give the patient feedback of your findings and also allow for question and answer session by the patient asking. Where possible, also give health education following the abnormalities that you have found. Report any abnormalities found from the patient to the sister in charge in the ward, and therefore record everything that you have done, because it is said that what is not recorded is considered as not done. Thank you.